Hello, good evening, and welcome to Cafdil Healthcare here on Cafdil TV. My name is Kojo Arthur. Today on our show, we are discussing kidney and AIDS-related diseases. We are live on all our social media handles, Facebook, Cafdil Cape Coast, and also YouTube, Cafdil EDU. My guests for today are seated already. When I come back from this break, I will introduce them. Stay tuned.
The National Catholic Secretariat Ghana presents the second National Catholic Education Forum. Date 10th to 15th March 2025. Opening ceremony 11th March 2025 at 9 o'clock a.m. Venue Eastern Premier Hotel, Koforidua. Theme Catholic Education for Integral Development, Shaping a Resilient and an Inclusive Ghana. Keynote address by Dr. Charles Abugri. Dignitaries, Apostolic Nuncio to Ghana, most of the bishops of Ghana Catholic Bishops Conference, Minister of Education, Regional Minister, the Traditional Council, Professor Joe Force Anamua Mensah, educational stakeholders, principals of colleges of education, heads of educational institutions, Executive Director of African Education Watch Ghana. Remember the theme, Catholic Education for Integral Development, Shaping a Resilient and an Inclusive Ghana.
Welcome back. If you just tune in, this is Cafdil Health Talk Show here on Cafdil Television. My guest for today, Sana Poku Efriye Ansa. He is a physician specialist, Cape Coast Teaching Hospital, and also Stella Kra. He's a general nurse, Cape Coast Teaching Hospital, and also Christopher Papo. He is a renal nurse from Cape Coast Teaching Hospital. Lady and gentlemen, you are welcome.
Thank you.
I hope you're good.
Yes. Yourself?
I'm good. I'll start from you, Doc. But growing up, I saw a certain gentleman. They were fighting, and the other guy said, he did this. Look at my intestine. If you joke, I'll break your kidney. And he did this. Doc, in our body, where is the kidney located?
Okay. So the kidneys are is a paired organ. So everybody has two kidneys, or ideally everybody should have two kidneys. Okay. They are located somewhere in the middle of the abdomen, more to the back. So in our language, we say it's in the posterior aspect. So it's more to the back of your abdomen.
Oh, okay.
So that's where everybody's kidneys are, one on each side of your spine or one on each side of your backbone.
So the guy pointing here.
Very far away from the kidney.
So far away. Now, so let's get talking. What is a kidney, and what are the role do our kidneys play in overall health?
Okay, so our kidneys, as I said, there are two, is a paired organ, okay? Very, very crucial organs in our body. They do a lot of things for us, which go unnoticed generally, okay? So the main function of the kidney is to filter all the waste in the body and bring it out as urine, okay? So all the blood in your body, almost every 30 minutes, all the blood in your body passes through your kidneys, okay? And as it passes through the kidney is going to draw out all waste material you've produced from what you've eaten, what you've drank, medicines you've taken, anything that has built up in your body that shouldn't be there. Your kidney is going to draw it out of your blood, let it enter the urine, and then that's what you pee out. So simply, that is what the kidney does. That is basically what the kidney is doing, okay? It's responsible for helping you also produce blood to an extent, okay? So usually when people have kidney problems, you realize that their blood levels begin to drop. The kidney is also responsible for maintaining a very fine balance between all the chemicals in your body. The body feels this is too much, the kidney helps to bring it down. This is too low, kidney helps to bring it up. Okay, so it's basically like a regulatory mechanism, a gate. Helps to open and close, let this in, let this out, let this in, let this out. And that's basically what your kidney is doing, to make sure everything is fine in the body.
Christopher, why are these kidneys so vital to our well-being, based on what the doc have just elaborated?
Okay, thanks very much for your question. So the kidneys are very vital because, as he said, every 30 minutes, the kidneys will filter your entire blood and take out toxins. And so when the kidneys are not working, it leads to an accumulation of excess water and toxins in the body, particularly or especially urea. We have a toxic substance called creatinine, and then sometimes excess electrolytes, especially potassium, which can be very detrimental to our health. Also, as he said, the kidneys produce a chemical that helps to improve our blood or our hemoglobin levels. And so patients with kidney diseases usually suffer from anemia, as he mentioned. And then when the urea also builds up in the body, it causes a condition called uremia. And the uremia will manifest itself in so many ways. One of the dangerous manifestations of uremia is encephalopathy, which means that the urea will travel up to the brain in excess, and then it will cause psychiatric-like symptoms or signs and symptoms. It can also cause seizures and other complications, which are very, very detrimental to the body. Then the kidneys also act on vitamin D, or they activate vitamin D, which helps in the absorption of calcium, which helps to strengthen our bones and stuff. So when the kidneys are not functioning, and usually they also result in what we call mineral bone disease or mineral bone disorders. So patients may have fragile bones, the body is not able to absorb calcium to make the bones stronger, so the remaining calcium in the bones, the body will be drawing it up little by little, leading to the bones becoming weaker, brittle, fragile, and all that, which is also detrimental to our health.
You made mention of, is it psychiatric-like symptoms? What are you referring to?
So there is restlessness, there's confusion, there is, the patients become restless on the ward, and sometimes they'll be talking abnormally as though they were. So you take them for, or you mistaking them to be maybe psychiatric disorders. That's why I mentioned it that way.
Nowadays, you've modified that word, abodam, that kind of thing. You are coming out with new terms because we have a kind of behavior like we are abodam, that kind of thing. It's good that we are getting new words for those things. Let me come to Stella. Before something can manifest, there should be some signs and symptoms of that kind. So, what are some of the signs and symptoms for this kidney disease?
Okay, so the nephrons in the body, in the kidneys, are about 1.5 million. So before you would notice that you have a kidney condition, then it means a lot of them, their functions have been lost. So the person would be getting to the chronic side. So with that, you see the person can be nauseating, would feel like vomiting. Some of them do vomit because of the uremia toxicity. Some of them too will be having itchy skin. And because one of the functions of the kidney is to be excreting water, you see they have water build up. Some of them will be having edema. They have swollen feet. Some of them will be having
Are they all these
face.
early signs?
They are not early signs. That's why I was saying that because the nephrons are a lot.
Okay.
Before you realize you have such signs and symptoms, then most of them have been depleted. So these are the symptoms you can see within the person. And with them, some of them will also have ascites, which is swollen abdomen. So at times somebody will say the person has been cursed. That's why the person is having a bigger abdomen. Yes. And some of them also have sleepless nights. They cannot sleep, they become restless. So these are some of the signs and symptoms they'll be having. Some also become anemic, very pale, because the blood production side of the kidneys will also be affected. and they mostly have high blood pressures because renin is not produced, and so it can regulate the blood pressures in the body.
Okay.
So you'll be having high blood pressures too.
I think this word wabondia cares, and nowadays I think people are beginning to understand that kidney causes those things. So we don't normally hear of wabondia. It's been a while since I heard this. Doc,
You'll be surprised. Yes, there's been an improvement in it, but till now we still have people relating a lot of disorders, not just kidney health, other disorders to spiritual beliefs. Okay. Sometimes, if they come in early enough, we're able to educate them, be able to diagnose whatever the problem is, and then offer the medical help that we can give. But then, to a large extent, we still see a lot of people believing or thinking that whatever condition they have is as a result of spiritual curse or something of sorts. And to add on to what Stella said, what we need to understand is, majority of the time, kidney disease is not going to show up just like that. You don't have a kidney problem on day 1, and then by day 2 or day 3, you have all the signs and symptoms of the kidney disease. Majority of the time, it is going to go unnoticed for a very long time. It may be months, it may be years, until, as she said, almost all your kidney function is gone. And then at that point, you start having all these signs and symptoms of kidney disease. Okay. So as it is progressing, there are some other things that you can look at, especially with urine. As we said, the urine is what is going to come out of the body. For some people, they may produce too much urine, far more urine than they usually would be producing. For some people, it is now that they will produce very little urine. So maybe in a day you were peeing maybe 3 or 4 times a day. Anytime you pee, let's say it would maybe fill a small bottle of water. Over time, you realize that now you're peeing maybe once a day. And when you pee, it's just maybe half a bottle of water. For those of us who observe the urine too, you realize that when you pee, it forms lots of bubbles, okay? And these bubbles stay there for a long time. That's a sign of kidney disease, okay? That it may, let's say it may be a sign of kidney disease, okay? You pee and there are so many bubbles in there. Some people at night, they are not peeing a lot during the day, but at night, over the period of sleep, they may have to wake up to pee maybe 5-6 times, okay? That may be a sign of kidney disease. Kidney disease can manifest in so many ways, especially in the early phases when you are not really picking up anything. But then by the time you come into the hospital, it blows out of proportion, or it's very obvious. As she said, now there's so much buildup of water in your body. You are feeling nauseous all the time, feel very tired because your blood levels are most likely low. You start feeling your heart beat a lot when you try to walk around. When you do anything little, you're tired, okay? So those are things you should look at. And it all puts into why we educated people on kidney disease, or we try to draw people to check their kidney function early, okay? It takes a long time before your kidney function is going to drop to such a significant level where you have all these problems, okay? So if you actually went to the hospital and checked your kidney function regularly, if you actually did have a kidney problem, it would have been picked up early enough. We'll pick it up early, and then we can start trying to halt or slow down the progress of your kidney disease from it going to like the very far or end stage kidney disease. Okay.
So how, or is there, or are there specific lifestyle choices that can either protect or harm kidney function over time?
So yes, generally there are some lifestyles that would make it more likely for you to develop kidney disease. And vice versa, make it less likely for you to develop kidney disease. Majority of the kidney disease we see in our setting is as a result of chronic illnesses, non-communicable disease like hypertension and diabetes. Okay. So the same education we generally would give to diabetic and hypertensive patients would also help you keep your kidneys healthy. So alcohol reduction, avoiding alcohol as much as possible, okay? Smoking is an absolute no, smoking cessation. Then healthy exercise, you need to exercise, try to maintain a good enough weight, an ideal body weight, okay? Obesity is going to increase your risk of developing kidney disease. Drinking lots of water. Ideally, you should be in us, especially in our areas which is really hot, warm, okay? You should be drinking somewhere between 2.5 to maybe 4 liters of water. 2.5 liters would be 5 sachets of water, okay, each day, at least, a minimum of that each day, okay? Avoiding processed foods, okay? Foods, when we say processed foods, a lot of the tinned or canned foods, okay, they have a lot of them would have high sodium concentrations, okay? And the sodium is going to draw up fluid, and it's also a problem for you. So avoiding processed foods, avoiding herbal, in quotes, herbal medication, okay? There's a lot of anecdotal evidence that some of our herbal medications actually may damage the kidneys, okay? We don't have full-blown research out there saying, look, this is damaging the kidneys. But a lot of times, and I'm sure some of our people actually realize, but we see it as a sign of the drug, the herbal medication you've taken working. You take the medication and now you've developed jaundice. Your eyes have become yellow. Your urine color has changed, is now reddish or is darkish. We think, oh, the medicine is working now. You are actually maybe damaging your kidneys. Okay, so staying away from herbal medication. Avoiding, in our term, we say over-the-counter medication. So a lot of us, I feel like I have a headache, I'm feeling weak, I feel tired. I go to the pharmacy, I say, give me this, give me that, okay? Majority of, or a lot of medications we take should be taken at prescribed levels, should be prescribed by a clinician or somebody with the knowledge on how to prescribe appropriately, okay? So we know how much of it you should take, how long you should take it for, okay? A lot of these medications, especially painkillers, what we say, and non-steroidal anti-inflammatory. So examples of those are ibuprofen, diclofenac, okay? They can, at higher levels, or if you are abusing them, can damage your kidneys. So we need to be careful about those two, right? So avoiding these practices would generally improve your kidney health or make it less likely for you to develop such. You need to control your blood pressures, you need to control your blood sugar levels. That is if you are hypertensive or diabetic. If you don't know if you are, the best way is to do what? Walk into the hospital or walk to a pharmacy, let them check your blood pressure levels, let them check your blood sugar levels, okay? Nowadays, we are also having increased education, especially about the mining activities and then their possible effect on kidney illness, okay? There is some evidence that says that what we say heavy metal poisoning. Heavy metals are some metals that shouldn't ideally be in large quantities in our waters or in our environment, okay? Mercury, lead, things like that, okay? Once you are exposed to that high levels of them, they can cause kidney damage. There are no papers or research, there's no, in our field we work with research. The evidence must be there. So far, I'm sure there's research going on to be able to write out or confidently say, look, water coming from here has these levels of these chemicals, it is causing kidney damage, it's doing all of that, okay? But then, yes, there is that suspicion that heavy metal poisoning is also a significant contributor to kidney disease.
You're still watching Cafdil Healthcare here on Cafdil Television, and we are discussing kidney and its related diseases. I'm hoping that you follow us on our social media handles: Facebook, Cafdil Cape Coast, and YouTube, Cafdil EDU. But Christopher, do we still have this kind of misconception? People still have it. Do we still have it around this kidney disease? Do we still have misconception?
Yes, I would say yes, in the sense that one, generally as Ghanaians, we hardly do check our health, and two, because of the, in quotes, the phobia that we have about treatment options for kidney disease, people will hardly want to hear anything about kidney disease. The last thing somebody will want to hear is you have kidney failure or you have kidney disease. Yeah, so they will even never want to go and check in the first place. So misconceptions are there, and like we are saying, even though now education is going on about these cases and stuff, people are becoming more enlightened that it may not necessarily be a case. It may be your kidneys, or most likely the kidneys are affected one way or the other, because we hardly check on our health in general.
Sir, I will come to you, but let me come back to doctor again for this one. You made mention, you said that kidney filter, whatever. So how do that kidney filter waste? How do they filter out waste?
Honestly, it's a very complex process to explain the working of the kidney. But basically what it is blood is pumped through your kidney. Okay. As the blood flows through the kidney, there's a part of the kidney, what we call the working unit of the kidney. It's called the nephron. The nephron has different portions to it that all do different things. Okay. As the blood goes through the kidney, the body knows I need this, I do not need this. Okay. So there are different things on the nephron. It's basically like a tube. You have the blood is flowing through a tube. As it goes through the tube, there are some things that can pass into the tube, and there are some things that can come out of the tube into what we call interstitium. Okay?
The same tube.
The same tube. That tube is what we see is when we say it has so very, very tiny holes in it that allow for things to filter in and out of it. Okay. And as the blood goes through the nephron, the things that the body needs will be taken out and kept. The things that the body does not need will be pushed out to go and form urine. Okay. That is the most simplified way. The body knows what it needs and what it does not need. But when the nephron gets damaged, or when you lose working nephrons, now they cannot do all the work that you had 1.5 million. Now you have 100,000. They cannot do the work 1.5 million were doing. Okay. So now you have a build-up. It's like a backlog of work that they need. That is there. So now you have the build-up of chemicals, as she mentioned, my colleague mentioned. You have the build-up of these chemicals in the body. And that is basically how gradually your kidney decline is going to occur. Okay. The filtration process is a very complex process. There are so many chemical processes involved in there. But basically what it is blood goes through your kidney. Your body knows I need this, I do not need this. Okay. Based on what is happening in the body system, and it can push things in and out. Sometimes your body may decide that I need sugar, so let me keep the sugar. Sometimes your body will feel like there's too much sugar in the blood, so let me push out sugar into the urine. It can depending on your body status at the time. Okay. But basically, there are some things that are definitely, I do not need it. The body must push it out. Example, urea, which is a breakdown of protein all the proteins we eat, your body will break it down, and the end product is urea. Once urea stays in your system too much, you have problems. So the body definitely pushes it out into the urine. Okay, so that's basically how your kidneys function.
Then the filter thing must be very crucial in the body.
Yes, is for those of us who have nowadays there's this advent of boreholes. Okay, the filtration system. If you pump out water from the borehole and you do not filter it, you cannot use that water.
Yes.
Exactly what it is. That filter, that's what your kidney is doing. It must filter and take out the waste and leave what is good for you.
But bringing in this, you see, when the filter thing, the water filter that you're talking about, when it fills the water for a very long time, you don't clean it. Even the color changes.
Yes. So how do you clean your kidney?
Does it also happen?
Drink lots. How you clean your kidneys by what? Hydrating, drinking lots of water,
Okay.
not giving it things it shouldn't be getting. So reducing the alcohol, no smoking, make sure your weight is good enough, eating lots of fruits and vegetables. Okay, so that's how you clean your kidneys.
All right. Now let me come to Stella. Even though you've mentioned some of the causes and stuff, I want you to, gradually let us know the main risk factors for chronic kidney diseases, and how can people with these risk factors manage their health?
So the main risk factors for chronic kidney disease is hypertension and diabetes. That's the main risk factor, people with such conditions. And it's not just general, poorly controlled hypertension and diabetes. We have people who are hypertensive. They don't go for a clinic. They faltered for a long time. And their blood pressures begin to rise. It affects the kidneys. You meet such people, maybe the person went to the market, the person was just walking around and all of a sudden the person just fell down. Probably the person's blood pressure has become very high. They end up getting ischemic strokes and other things. So if they are poorly controlled, but if they are well controlled on medications, that is fine. But poorly controlled diabetes and hypertension are the main risk factors.
This diabetes, I think they are twins, because whenever anybody mentions hypertension, it has to go with diabetes. Diabetes, hypertension. Are they twins in any way?
So they are not twins, but they feed off each other.
Oh, okay.
They generally feed off each other. And so once you develop one, especially diabetes, there's a very high likelihood you may develop hypertension later on. Okay. To draw us back to, you mentioned myths about renal disease. A lot of us feel young people cannot have kidney problems. Okay. It's a very big myth. Usually it's the older generation, older people that have kidney problems. But younger people can develop kidney problems. A large number of people with kidney failure are young people, okay? Because of, changes in lifestyles and then other things that could cause you to have a kidney problem. For chronic kidney disease, when we say it's a chronic kidney disease, that means that the problem, your kidney function, has been bad or has dropped for more than 3 months. It should be at least a 3-month period. Or there has been a change to your kidney. Okay, so the kidney function hasn't dropped over 3 months, but your kidney, there actually has been a change to your kidney. And that alone is enough to say you have chronic kidney disease. Hypertension, in our setting, hypertension and diabetes are the most common ones. But there are a lot of other ones that we ignore or we don't pay heed to. We need to first think that we can have acute kidney injury. When we say acute, it is a sudden, in a very short period of time. That
was what I was coming to ask, that stages of...
So acute kidney injury is different from the stages of chronic kidney disease. There are plenty causes of acute kidney injury. And what we need to remember is anything that will cause acute kidney injury can in the long run cause a chronic kidney injury if it is not managed well. And a very shocking or scary thing is a simple bout of diarrhea and vomiting for you can give you acute kidney injury. If it's not managed well, in 6 months' time, you can come with chronic kidney injury. You just had a bad diarrhea and vomiting. You ate some food somewhere and it gave you a tummy upset. It could give you acute kidney injury. If it's not managed well, in 6 months' time, you come with chronic injury. You got sick, very sick, and the sickness can cause acute kidney injury. If it's not managed well, 3 to 6 months' time, you can come with chronic kidney injury. Pregnant women can develop hypertension in pregnancy. They can develop other complications in pregnancy. The big term they call is preeclampsia, okay? If it is not managed well, in 3 months, 6 months, end of the year, they will come with chronic kidney disease, okay? So any cause of acute injury is going to cause chronic injury. And for chronic injury, apart from our most common hypertension and diabetes, other viral infections, chronic viral infections, hepatitis B can cause it, hepatitis C can cause it, HIV infection can cause it, okay? Then there are people who just they were born with it. There's a genetic composition to it. People who were born with problems with their kidneys are maybe too large, or there's a malformation with the kidney. You're at risk of chronic kidney disease, and they usually do develop chronic kidney disease if it's not monitored or managed well enough, okay? We've mentioned our herbal medication use, the drugs, those alcohol, okay? Obesity on its own can put you there, okay? So generally, these are a number of causes of chronic kidney diseases. Yes. Okay. And for some people, it's just an infection. You have had an infection as a child. Okay. A sore throat or a skin infection, and due to the processes that go on in the body, it will damage your kidney, and then in a number of years, you come with that problem, chronic kidney disease.
Okay. All right. So, Christopher, doctor started with the stages. So at what point should someone seek medical attention?
Okay, thanks very much for this question. When we come to the chronic kidney disease, it's in 5 stages. And the main is by laboratory investigation, by a blood workup, that we will be able to know the stage of the disease. And the main component that is used to determine the stage is called the estimated glomerular filtration rate, that's the eGFR. It has its normal values. In every healthy normal adult, it should be above 120. But when it is between 90 and 120, it's okay. But when it's above 90, and there is another clinical feature of kidney damage, we call it stage 1. Or anything 90 is stage 1. So when it's between 60 and 89 is stage 2. Then when it's 30 to 59 is stage 3. But stage 3 is a crucial stage, because not only is it in the middle of this whole process, people at stage 3 sometimes are able to reduce, or the eGFR, the eGFR is, let's tell me, the strength of the kidneys, in layman's terms, the strength of the kidneys tends to drop at a very fast rate. Some too tend to drop at a very low or a slow rate. So they have divided the stage 3 into stage 3A and stage 3B for the purpose of attention, for the purpose of early intervention. So you have the stage 3A, that's from 45 to 59, and then stage 3B from 30 to 44. You have the stage 4, which is between 15 and 29. Then stage 5, which is the kidney failure, is eGFR below 15. So the unfortunate thing about kidney disease is that once the EGFR starts dropping, especially if it is chronic, rather unfortunately, it cannot be reversed. Medically, it is very difficult. If it is acute and the cause is detected early, like Dr. Sana mentioned, diarrhea and vomiting, if you're able to restore the body fluids and everything, you can restore. But once it gets to kidney failure, unfortunately, medically speaking, it cannot be reversed. So when it gets to that stage, there are only 3 options for treatment. We have dialysis as one option, we have transplant as the other option, or we manage the symptoms until the patient eventually dies.
Hey. Oh, anyway, the kidney disease is very, very, I don't know the term that I should
It's
use.
very crucial.
But he made mention of reverse and kind of. So I was going to also ask whether the disease can be reversed or the damage, usually permanent.
So, acute kidney injury may be reversed.
Even that one is may.
May, depending on how early the intervention is, it may be reversed. Then you can get back to your normal levels. Even with that, once you've suffered acute kidney injury once, you need frequent, very regular monitoring of your kidney function.
Okay.
Because there's a possibility it will drop again. Okay. It is difficult for you walking around to know I'm at chronic kidney disease stage 1 or stage 2 or stage 3 unless you've gone to the hospital to check. You will never know. So the theme, World Kidney Day is coming up, yes. And for the past 3 to 4 years, the focus or the themes have revolved around early detection, okay? Preventing the kidney damage in the first place and early detection. So we are advocating people to take their kidney health serious, and you walk into the hospital at any time and request a kidney function test to be done for you.
Is it free?
No, it's not free.
Once you're celebrating your week there, celebrations to come with free.
So it's not free. It's walk into any hospital, get your kidney function test, and then you'll be able to tell.
Insurance cover it?
In some facilities, yes. In some facilities, it may not.
So CCTH?
I'd have to check.
You don't want to commit yourself.
So the thing is, it's a chronic condition. Once it's started, it is going to continue. Okay. The interventions we need to put in place when you're at stage 1, stage 2, stage 3 are all to slow down the progression, keep you at that stage for as long as we can keep you there.
Okay.
Because the lower you drop, the faster it's actually going to move. Once you hit stage 3, A, B, the decline or the rate of decline is very rapid if we are not very aggressive in keeping you where you are. Okay. So the whole point is, we pick you up at stage 1. We can pick up why you developed that kidney disease in the first place and keep you there. Whatever medications, lifestyle modifications you need to do to make sure you stay at that level for the longest time, you stay there. There are a few people that manage to move up. So maybe you were picked at stage 2 or stage 3A, and with the interventions, you managed to move you up. Maybe you are at 3A, now you've moved up to 2. Or maybe you are at 2, you've moved up to 1. There are some people that may have that with very good interventions, very good lifestyle modification changes. They can move up. But generally, it is not reversible. Once you have gotten to especially once you've gotten to the end, there is no cure. The cure would be to get a transplant. So the medications that people advertise for curing kidney disease,
it's not.
There's no medication that will cure your kidney disease.
So what options are available for someone whose kidney are failing?
So the treatment options available is either the dialysis or the kidney transplant or with the medications. So with the dialysis, we have 2 types, the hemodialysis and the peritoneal dialysis. But here in Ghana, we mostly deal with the hemodialysis. and the hemodialysis deals with your blood. So we get you an access either on your neck, which is a temporary one, then you later get a permanent one on your arm, which is a fistula or a graft. So with that one, when you come, we connect the blood tubings to your neck, it pulls out the blood, it passes through the dialysis machine, then it filters out the toxins. Then you can go home, it's on OPD basis, you go home, then you come. So that is the first option. But with the peritoneal dialysis, the peritoneal fluid is usually injected into the peritoneum, within the abdomen. Then it's drained, but in Ghana here, it's mostly not done. And with that one, the risk of infection is much higher as compared to the hemodialysis. Or the other option is to go in for a transplant.
Doc, mentioning hemodialysis and peritoneal, how do you doctors determine which one is right for a patient?
So it's based on it's based on the patient's needs, the patient's conditions, the access to hemodialysis or peritoneal dialysis, okay, and what is feasible in the environment. Peritoneal dialysis is generally less stressful than hemodialysis on the body, okay. In Ghana, there are a few centers that offer peritoneal dialysis, but it's not as widespread, okay. And the beauty of peritoneal dialysis, or one advantage, is that you can do it at home, you know.
Oh, really?
It can be done, and you don't need to come into the hospital. It can be done in the house, okay. We usually see peritoneal dialysis done in Ghana for children, okay. And for adults, most of the time it will be hemodialysis. But then, some adults can get peritoneal dialysis done. But it's all based on the resources available to you and what is best for the patient, what is going to maintain their health as best as possible. In Ghana, majority of the centers are hemodialysis centers. That's what we have lots of access to. Well, that's what we have relatively good enough numbers for hemodialysis, yes. And then the other option is getting a transplant done. So all three of them, generally we call them, in the broad term, is renal replacement therapy. So we basically need to replace your kidneys. So whether it's hemodialysis or it's peritoneal dialysis, they are replacing the function of your kidney. They are doing what your kidney should have been doing for you. Yes.
Since you are celebrating this World Kidney Day, I will let you elaborate the activities that you have. But before that, Christopher, what are some of the things that we should be doing to prevent these kidney diseases?
So, as my colleagues have earlier mentioned, when you look at all the risk factors and possible causes or things that generally cause kidney diseases, if you're able to prevent them or manage them well. So in the case of hypertension, we have to check our diets, make sure that we restrict the use of artificial flavors or seasonings in our diets, especially the cubes, because of the chemicals that they contain, especially the sodium content. You know, it's very, very funny that someone will put, let's say you're going to prepare jollof rice, for instance, just an example. You put in salt, and then you also add cubes or seasonings, simply because you want the food to be nicer. So at the end of the day, you end up loading the salt too much, or the sodium content in the food so much, which will in turn increase your BP and put you at a higher risk of. And then for the fact that it is also a processed product, you know, they when they are processing it, they add some few chemicals, phosphates and other things, which also damage or can, in the long run, they damage the kidneys. So reducing cholesterol in our diets as well, eating healthier diets in general, hydrating more, drinking more fluids, not only water, but fluids, drinking more fluid, healthy fluids, avoiding these caffeinated and carbonated drinks, energy drinks, will also go a long way to help us to restore or to keep our kidneys healthy. Avoiding of over-the-counter pain medications, especially the NSAIDs, like Brufen, just as Dr. Sana mentioned, diclofenac and stuff. Keeping a regular or having regular checkups on our kidney health, all these things also go a long way to help with our kidney.
Doc, you, as part of the treatment, you made mention of transplant, and that involves the last stage, right? I mean,
Yes.
also there should be some challenge. So I want to know what challenges do kidney transplant patients face, both physically and emotionally?
I think you don't need, you shouldn't even get to a transplant stage. But from all stages of chronic kidney disease, there's an effect both physically and emotionally on the patient, because you are diagnosed with a chronic illness. Okay, the time lost in quotes, attending clinics, going for hemodialysis sessions, the medications you need to purchase, people who may need to take care of you, and all of that is a whole lot. Okay. So there is a very significant enough burden on the patient and the caregivers around, both physically and emotionally. When it comes to getting a transplant done, initially we were not doing transplants in Ghana, but now we have transplants done in Ghana.
Oh, really?
So yes, and then there's a new renal center that was built. The new renal center in Kolibu has been doing transplants. So now patients do not have to go outside the country for transplants to be done. It can be done here in Ghana.
It must be expensive.
So usually cost is a barrier to most people getting transplants done. But when you think about it long term, when you put the cost together long term, getting a transplant is more cost effective than doing the dialysis sessions. Okay. But then the initial capital is what is the problem. Over the years, I mean, getting a transplant outside was averaging anywhere upwards of about $30,000 US. Okay. But now in Ghana, you can get it done. You don't need to travel outside. Okay, because traveling, the 30,000 is just the cost of the surgery. Your transportation, like your air for you and your donor, labs you are going to do, all of that is not there. But the transplant process is a very long process, okay? From deciding, okay, I want to get a transplant, the medications and evaluation that needs to be done for both you and whoever is going to donate the kidney to you. So donors are generally restricted to family members. You cannot buy or pay somebody to donate a kidney to you.
What are you, the person outside thinks that I can do to
So
help?
because of black market kidneys, it's not allowed. It's a family member who can donate to you. Okay. Otherwise, then it becomes a business. I feel like, okay, I'm broke, I need money. Let me sell my kidney for 120,000. Okay, all right. So it is restricted to, the transplant laws in Ghana are still being formed and all of that, but it's restricted to family members. And it's a very long process. You go to court, you'll be interviewed. We need to make sure that this is not being done under duress or coercion. You are not being paid, you are not being forced to donate your kidney to whoever it is, okay? Then you need medical evaluation. We need to make sure that you indeed are a right match to the person who is going to receive that. So there's lots of tests that need to be done. You need to be fit. The donor needs to be fit, okay? Make sure they don't have any chronic illnesses, they don't have any infections that they may pass on. They need to make sure you are a match to the recipient. So lots of labs, lots of evaluation needs to go on. And then the transplant would be done. So it's not today I decide I want a transplant, then in 4 days time I'm getting the transplant. No, it can take months before the transplant is finally done. Okay. Yeah.
Now,
And
so
then
what is
post-transplant,
Yes.
post-transplant, you, the recipient, the one who receives the transplant, is going to be on medication for life. Okay, you need to take medicine because there are complications that may arise because of the transplant. Your body is built to fight anything that is not for it or from it. So once you receive something from somewhere else, your body will fight it. So you need to take medication to prevent your body from fighting the new kidney that you've been given. So the cost of those medications is there. The stress of taking those medications is there. Okay. Then once you are taking these medicines are stopping your body from fighting the new kidney. But then the effect is stopping your body from fighting so many other infections too. So now you're at increased risk of picking up infections, picking up any other complications that are there. Okay. So it's very capital intensive, yes, and then the complications of your body fighting it, or the kidney not even working. Sometimes you may transplant and after a while it may just fail. Okay, that is also a possibility.
Is it the donor or the receiver?
The receiver's the new kidney that is put in there may also fail.
Hey. And
so it's transplant. I mean, it's a great option. And
but the donor, no?
Yes. The donor now, you have only one kidney, so you also need to take steps to maintain that one kidney you have.
Are you also going to be on medication for life?
No, you don't need to be on medication, but you need to change your lifestyle to make sure that that kidney doesn't get damaged in any way. Because if it does,
then you are going.
You also have a problem now.
All right, so our time is up, but I want you to tell us
the Kidney Day.
Day. What's going on?
The month of March is for kidney awareness. Okay, every year we celebrate World Kidney Day on the 13th.
On the second
Thursday of the month of March. That is when we celebrate World Kidney Day. Okay, but then the whole month is for that. So throughout the month, or we even started. Okay, from education, going around, campaigning, telling people about kidney health, pushing them to go into the hospital and check their kidneys. Okay. For our celebration, we are going around. Every year we have a place we go to. This year we are deciding to have it at Chapel Square.
Cape Coast Chapel Square.
Cape Coast Chapel Square. So we'll have a mass screening.
For free?
Yes, for free.
This one, yeah.
So it's a screening. It's a screening. So we are not going to take blood work and do a kidney function test, but we'll look at your urine, we'll look at your blood pressures, we'll look at your blood sugars, we'll look at your weight, all these risk factors that may predispose you to kidney health. So if we pick up abnormalities in any of that, we tell you to come into the hospital and get further evaluation. The day before, there will be a float, okay, starting from
Pseudo Methodist Church.
Pseudo Methodist Church, a float.
Yes.
Yeah. From there,
through the principal streets of Kotokraba. So we pass through Infantipim Junction to Kotokraba Market. Then we branch towards
Municipal.
We branch towards Kingsway.
You go straight.
So you go straight to Kingsway. And
so from Kingsway you go
Square.
to. Okay.
So yeah. Welcome to joining on the float, coming for the screening too, okay? And educate, spread the word, go out, check your kidneys. This year's theme is, are your kidneys okay?
Detect early, protect kidney health.
Okay. Are your kidneys okay?
Yeah.
Detect early.
Protect your kidney health.
So if I ask you now, are your kidneys okay?
Yes.
Can you answer the question?
I can.
Are you confident?
How would I even know?
Exactly. So how would you know? Go into the hospital and get it tested.
We'll try and come.
Yes.
Okay. So I'll give each some 30 seconds. Your last word.
Okay. Thanks very much, and my regards to all the viewers here. I want to encourage all of us to take our kidney health serious, because kidney health is such that once you lose your kidney function, once you lose them and you get to end stage, it is irreversible. So let us drink lots of water, let us take good care of ourselves, let us exercise, avoid or reduce as much as possible the caffeinated drinks or the carbonated drinks, the alcohol, smoking, spices or artificial flavors that we add to our food. And in case you are caring for a kidney patient, please exercise patience because the disease comes with its own stress.
All right.
So let's be a little
Thank you.
patient.
Millie.
Thank you.
Stella, sorry.
So, my regards to the renal dialysis unit, all the staff there, they're really doing well. So I really appreciate them.
Look,
Now, I would also
you
say
haven't
that
finished yet.
we should also avoid the over-the-counter medications. And if you've been diagnosed with any chronic conditions,
Over the counter, use the local name that we know.
and you call it drugstore, yes. So,
Over the counter, you don't know.
so if you've been diagnosed with any conditions, make sure you adhere to your treatment,
Okay.
lifestyle modifications to help protect your kidney health.
All right.
Thank you.
Thank you.
Kidney health is a growing concern. It's always been a concern, okay, and it's getting worse. The only way to know if your kidneys are functioning well is to go to the hospital early enough and get it tested. So you can do yearly or 6-monthly checks in the hospital. And when you are going, drag a family member along or a friend along, because you never know at what stage your kidneys are in until you go and check. Okay. And if you are in doubt, if you have any need, any concerns, any questions, the hospital is there. You can walk into any hospital and ask all questions and they will be answered. Okay. So we need to improve our health-seeking behavior. That's what it's called, health-seeking behavior. We are fond of not going to the hospital at all until we are almost dead. The hospital is a place you should go to whether you are healthy or not. Okay. Thank you very much.
All right. They said, I don't know, is your kidney okay?
My kidney is okay.
Yours? Hey, yours?
Sure.
No, mine is also okay. All right, this is where we end the show today. They said we should take at least 5 sachets of water every day to stay hydrated to impact our kidney functions. You heard Dr. Sana Pukwe Ansa. He is a physician specialist at Cape Coast Teaching Hospital. And also Christopher Pakpo, renal nurse, CCTH, and Stella Kra, also a general nurse at CCTH. I appreciate your efforts. So thanks for watching, and thanks to all the crew. Same time next week. God be with you.